Good morning friends, I am Dr. Raman Raj. Today I will be discussing with you some general points about heart diseases and some general do's and don'ts and how to avoid the heart diseases. First of all, I will be discussing about heart pain or cardiac pain. What type of pain is probably due to heart disease? Chest pain, which is central in location or retrosternal in location, means the chest pain which is diffuse, not localized, occurring in the central part of chest pain, which is radiating to your upper arm or your back or your jaw, is most probably due to heart disease. Pain which is occurring during exertion or walking is most probably due to heart disease, and pain which is of constricting type or pressing type or choking type of sensation is most probably due to heart disease. And when pain is associated with shortness of breath or palpitation or symptoms like dizziness and it is relieved by rest or nitrates, it is most probably due to heart disease. Angina or chest pain due to heart disease is most commonly caused due to critical blockage in arteries supplying the blood to heart itself, that is coronary artery blockage. When the coronary artery blockage is more than 70% of the luminal area, then the symptoms of angina pectoris commonly occurs, and as the blockage increases, the symptom in the patient increases, and when this blockage suddenly increases to 100% due to various reasons, then heart attack occurs, which is called myocardial infarction in medical language. Heart disease, as we know, is a multifactorial disease. That is, it is caused by multiple risk factors. Risk factors can be divided into modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are most important that we can modify, and thus heart disease can be prevented. And the non-modifiable risk factors are like increasing age, male gender, family history of heart disease. If your parents are having heart disease or your sibling is having heart disease, then you have higher chances of getting heart disease. And coming to most important factors, that is modifiable risk factors, the most important modifiable risk factors of heart disease is hypertension or high blood pressure. High blood pressure can be attributable to more than 60% cause of stroke worldwide and more than 50% cause of heart disease worldwide. Approximately 25 to 30% of our general population is suffering from high blood pressure or hypertension, and so it is recommended that every adult should get his blood pressure checked yearly after 20 to 25 years. And if one has high blood pressure detected, then he should avoid taking tobacco, he should control his weight, he should avoid high salt intake, he should increase his physical activity, he should increase his fruit and vegetable in diet and avoid taking alcohol. Hypertension prevention can prevent us from stroke and heart disease and kidney diseases. So if you have detected to have high blood pressure, then take your medicines regularly and frequently check your blood pressure. Second important risk factor is tobacco. And it is the most preventable cause of heart disease. Approximately 10 to 15% of cardiovascular disease can be attributable directly due to tobacco intake. Any form of tobacco is injurious, like cigarette intake or bidi intake or tobacco chewing are all equally deleterious. Both active smoking and passive smoking are both deleterious, and one should decrease their risk of getting heart disease immediately after stopping taking tobacco in any form, and the risk decreases to more than 50% in first 2 years after stopping tobacco intake. Third important risk factors of heart disease is high cholesterol level, that is high lipid in blood. High cholesterol level is associated with more than 50% causes of heart disease and more than 20% of strokes worldwide. And screening for high cholesterol level should be done in any male who is more than 35 years of age and any female who is more than 40 years of age. And if you have tendency to have high cholesterol level, then you should avoid taking saturated fats on oils like animal fats, dairy products, vanaspati, shuddh ghee, palm oil, coconut oil. These are to be avoided, and oils which are relatively safe are which are rich in multi unsaturated fatty acids and polyunsaturated fatty acids and monounsaturated fatty acids. And these are like olive oil, canola oil, rice bran oil, sunflower oil, etc. And one of other important thing is that the quantity of fat intake should be decreased. Not only the quality but quantity should also be decreased, and quality should be better with those with monounsaturated fat. Avoid using the same oil or fat for cooking repeatedly. That increases the amount of trans fat in the food, which is very dangerous for heart disease. Another important modifiable risk factor of heart disease is diabetes. Around 15 to 20% of Indian population is suffering from diabetes, and it is very common in low and middle economic group also. 90% of type 2 diabetes is associated with obesity, and if you have detected to have high blood sugar, that is if you have diabetes, then avoid simple sugar, avoid diets which have high glycemic index, like taking carbohydrate diet, take complex carbohydrates more, and increase your physical activity, and take more fruits and fiber in your diet, and take your medicines regularly. Physical inactivity and obesity are also important risk factors for heart diseases, and if you have central obesity, that is fat around waist, is more deleterious than fat anywhere else in the body. And if you are obese, that is your BMI is more than 30, you are more prone to develop heart disease than who are normal weight. And regarding physical activity, one should do at least 30 minutes of exercise at least 5 days per week, and avoid getting extra calorie in their diet, and take control of their fatty food. One of the important aspects of cardiac disease prevention is diet, and it is very common question that what diet one should take and what diet one should avoid. So the diets which are important for avoiding heart disease, that you should increase the protein content of your diet and decrease the carbohydrate content of your diet. Increase fruit intake and vegetable intake more in your diet. Increase whole grain diet in your food, and avoid refined diet. And take fiber intake more, like vegetables, sprouts, etc. Increase water intake, and nuts like walnuts and almonds intake should be increased. Things that you should avoid are high quantity of fatty food should be avoided, and high intake of salt should be avoided, high intake of carbohydrates should be avoided, simple sugar intake should be avoided, fatty fish, red meat, and whole fat dairy products should be avoided, and alcohol consumption should be reduced. So in summary, increase your physical activity and take more fruits and fiber in your diet, and take your medicines regularly. Stay healthy and keep your heart healthy.